All right, so just a quick summary is we're looking at our chapter goals being initially the North Carolina Medicaid discussion. We're preparing for that so everyone can move in 2025. We're preparing for the national conference in 2024 and that regional conference coming up in the first half of the year next year as well. All right, so I've talked a good bit. I'm going to turn it over to Dana so that she could talk a little bit more about the So Everyone Can Move initiative. And then when she's done, I'll have some more remarks and then we'll open up the floor for some questions and discussion.
Hi, everyone. For those of you that don't know me, I have actually been in OMP, involved in the OMP profession in North Carolina since 1997. I am no longer in a patient care setting, but I still want to serve the patients that we have in this state. And I think one of the best ways that we can do that is coming together and supporting the So Everybody Can Move. And it has the support of AOPA, the Academy, the Amputee Coalition, and the AAOP. It really, the NCAAOP. So it is really something that is supporting and bringing together everyone across the country. And there has been a lot of success so far. And I hope that North Carolina will choose to be a part of that going forward. So I'm going to share a very short PowerPoint presentation that AOPA was actually generous enough to loan me. So for those of you, it used to be So Kids Can Move. What they found was that in some states have already done this initiative, that the support was not just for the pediatric population, but for adults as well. And when they saw that this was actually being successful and supported by the different state legislatures, then they decided to change it to So Everybody Can Move. And what it is to create equitable access to prostheses and orthoses utilized for physical activity as medically necessary. And right now, this is a state-by-state campaign. However, their goal is 28 by the year 2028. That means that if 28 states are successful in getting this legislation implemented in their state, then it can then become a federally mandated initiative. So that is the goal. If you will look on this map, you will currently see that there are 5 states where the legislation has been enacted. They are now in the implementation process. So we will actually have states ahead of us that will show us how it has been done and then how the implementation process should be done. And then there were 5 more states that introduced the legislation in 2023. And if you see, we are listed for those for 2024 and beyond. Right now, their agenda for 2024 is full, but that gives us a lot of time to really come together as a state organization to be involved. There's a lot of planning, and I'll go through that in a minute, but it's important that we be united in this. And not only with the clinicians, with the clinician or clinic owners, we need physical therapists, we need patients. So it's really going to be a very involved movement that's going to include a lot of people that are not on this call, but that we need to start getting that support. So I'm going to go through in a very brief part because politics is not my cup of tea. But this is just an example of the model legislation that they are starting out with in each state. It is important to note that each bill will be slightly different depending upon the state and what's going on. So I will go. It's an act to improve access to prosthetic and orthotic care for adults and children with limb loss and limb difference. And each of these bills is going to have a required coverage, a medical necessity and non-discrimination standards for coverage of OMP. And then there's going to be a reporting requirement, and then there's going to be the application of the bill. So the main part to look at in the bill is that insurance fairness. It will require state commercial plans to cover and reimburse OMP care at a level at least equivalent to Medicare. Now, do not mistake that to mean at a reimbursement equivalent to Medicare. It is actually talking about that if Medicare has deemed that these devices are medically necessary, then that is what the commercial plans must do. It also will require state commercial plans to cover activity-specific orthotics and prosthetics. And some states have been successful in not only to do it activity-specific, but also to cover shower or water legs as well. And it will require state commercial plans to cover OMP componentry, repairs and replacements, and provide the instructions on the use. So then we get into the medical necessity and non-discrimination standards. OMP was initiated as a part of an essential health benefit under the Affordable Care Act. And then we are asking that the payers require that both everyday and activity-specific care must be covered if the treating physician deems it medically necessary. So we're not just talking about prosthetics. We are also talking about orthotics. And one example that I can think of, and I know that causes a headache for people, especially with pediatric orthotics, are the daytime and the nighttime use, AFOs. It would also prohibit insurers from denying activity-specific OMP care that would otherwise be provided to a patient that does not have limb loss or limb difference to perform the same activity. So right now, insurers will pay for a knee replacement, no questions asked. As long as the medical necessity is there, they will pay for the surgery and the rehab of a knee replacement surgery so that a patient can still be active. Well, the AOPA has deemed or found the language that means that they should also be covering the care that would keep people with limb loss active. It would also exempt orthotics and prosthetics from the reasonable useful lifetime restrictions in the case of changing patient condition or device wear and tear. But keep in mind, in order for this to be successful, the correct compliant documentation will be a necessity. And then that would bring us to the reporting requirement, where that the payers would be subject to legislation where they have to submit a report on the claims to the state's insurance agency. So there would have to be oversight to make sure that they are not denying these devices. And then last is a timeline for legislative implementation. In most cases, it's not something that it passes and then becomes in effect the next day. There will actually have to be a process for the implementation of it. So in order for us to be a part of this initiative and to be successful, the number one part is going to be building our team. So step one is today's meeting. From today's meeting, we want the people here, people in your clinic, your colleagues that are not present, patients, physical therapists, reach out, start spreading the word so that we can develop our core team. Secondly is preparing your assets. I've already had a conversation with Jack. We actually are financially more sound than most of the states that have been successful with this legislation. But it doesn't mean that we won't need more money. It's really going to depend upon the course we take, whether we are going to do a grassroots type of movement or whether we're going to hire a lobbyist. I know in the past we did have the services of a lobbyist, but he was also a veteran. He was also a lawyer who had limb loss. So his fees were nominal compared to most lobbyists. We're going to have to go through the legislative process, which is kind of what I just outlined. We will have the other organizations, you know, AOPA, the Academy, the Amputee Coalition Association, and the NAAOP holding our hands. We're not going to have to do that part alone. Same with managing the legislative process and then expanding our coalition and collaborating. That means that as we go through this process and we see success, we help other states be successful in this movement. Step 5 is hopefully being able to celebrate our victory. But once we celebrate, which will be very brief, we will have to begin the implementation process for the legislation. And that's going to be a lot of education for the providers in our state. Let me stop share. The other thing is they have a website. AOPA has created a website, and I am going to put the link in the chat. If you will go to this website, you can actually subscribe to their updates. I hope that went through. Nope. You can subscribe to their updates and you will get email updates as it happens across the country and what is going on. I'm already involved with a couple of other people in participating in the lead advocate meetings that they have. They usually have at least once a month. But anyone is welcome that is supportive of this initiative.
Yeah,
Jack,
I just want to highlight, you know, to Dana's point, that this is a massive initiative that we're undertaking as a state. And although it's big, it's a very worthwhile endeavor that's going to help not only the clinicians and people in our state, but the clinicians and people across ONP and other states. So as Dana said, a lot of the big organizations are on board with this and have already been down this process in other states. So we need you and your involvement in order to stay unified, stay collaborative, and be able to get involved and help us move forward with this. Next, we're going to talk, and Dana's going to give a little bit of an update on the Policy and Insurance Committee. So we've had that option as part of the membership for an extra $10 that you could be a part of that policy committee. And so Dana, can you give an update for us?
Sure. And actually that just reminded me, I